Well, good day everyone. Dr. Mankal here from Barrhaven Family Chiropractic and Wellness Centre, Accrediting Wellness Centre. I have with me here Laura, who has graciously donated her posture part of her body to really demonstrate to the viewers that getting an adjustment is something that is not a painful process, and that it's very comfortable and very safe, because over the last 21 years we've had many patients who've really suffered for so many years, whether it be children or adults, that they've really not motivated themselves to come in to get a checkup to see whether we could help them, because they maybe thought that the adjustments would hurt them more and so forth. So I just want to show kind of some of the basic analysis that we do, and then maybe show a style of an adjustment that we'd apply to be able to correct sort of the pattern that we see. And Laura again has graciously donated her time and her body to make it happen. So, and she'll be better off for it, by the way. So, posture is the window to the nervous system. And we've all had this visual of our old grandparents kind of moving through life like this and suffering for years, and that pressure in the spinal cord that really destroys their ability of their body to function normally. So, one of the first things that we do during the examination is we look at your posture in a three-dimensional format, from the front, from the side, and from the back. And we compare that to the x-rays that we would take with them. And Laura has probably one of the more common presentations of the posture, so we're going to show you what that would be like, and then what it would be like to actually make an adjustment and to see that change right in front of you. So Laura, I'm going to have you sort of turn this way so the viewers can see this. So her hands are by her side. I'll ask her to close her eyes and nod her head up and down. Perfect. Now, one thing I want to show you with Laura is you'll notice her, if we drew a line in front of the ear straight downwards, it falls in front of the tip of the shoulder. We actually want it to be back in through here. So that tells me that she has a pattern of subluxation that's caused her spine to do this, and is now putting some pressure on these nerves, which really affects the whole body, from immunity, maybe causing headaches and migraines, sinus problems, allergies, heart problems, digestive problems, even affecting focus and concentration. So this is a very big area that needs to be addressed to really get well in life. So the way that we would address that and to make an adjustment is I'm going to show you. So Laura, I'm going to have you lie down. We're going to change. Our tables are very special because we can actually alter the position of the table. And line your back for me. I'm going to have Laura slide up a little bit more. Great. So now, in this adjustment, we're going to just lower her ear so that we're just sort of in line with her shoulder. We're going to really address a large part of the nervous system, which is via her posture. And just hold that for a little bit, and we're going to reverse that to reduce the subluxation, the stress on the nervous system. Now, Laura, does that hurt?
Not at all.
Now, be honest.
Not at all.
All right, good. So we hold that for a bit to change the way these nerves are firing, the way that they have been programmed over the years. And these tables have a special mechanism on, a little drop mechanism. This is kind of what it sounds like. Okay. So what we'll do is we have a little bit, we contact in here, we have her chin tuck, and we have her breathe out for me. And that's kind of what it's like. And we would change the way these nerves are being programmed to dysfunction into more function. And so that's kind of the way that one of the styles of adjustments are being done. And it's similar with kids, depending on how old and how small they are. If they're infants, the pressure that you put onto your eyeball that's comfortable, that's the amount of pressure that we would use to change the neurology and affect improving their function. So that's I wanted to show you that to get you guys comfortable, so because you don't have to suffer needlessly and to thinking that the adjustments hurt. There it is there. And just one more. Good. So we're going to have Laura come on up now. Good. Come on over this side for me, Laura. I want you again just to look straight that way for me. And again, just looking at it, we can actually see a change in her neurology, and that her head now is more so in line with her shoulders. And changing that over a period of time now gets to really change neurology and gives her body the best chance to heal and function better. So I hope that answers some of your questions and your concerns about fears about being adjusted, and we look forward to seeing you soon.